Joining us today. For those of you that don't know me, I am Bob Whipperforth. I'm the president of the Village of Windsor, and I also serve as president of the Dane County Cities and Villages Association. We periodically do these roundtable discussions for our membership and others that can join us. We try to pick topics that would be of interest to people. So today we're going to be talking about mental health, and we have Jake King from the City of Sun Prairie as one of the hosts. He will introduce his co-host. I just want to remind people that if you can keep yourselves muted during the presentation, that would be appreciated. And then Jake and Jo will be talking about whether they want to take questions during the presentation or wait until afterwards. So with that, welcome everybody again, and I will turn it over to Jake. Welcome.
Awesome. Thanks, Bob, for having us and talking about this topic, which I find a lot of communities are kind of working through and figuring out where they belong with it. And so, yeah, my name is Jake. I'm the City of Sun Prairie's Communications and Diversity Strategist, and I'm joined today with Jo Oyama-Miller, and we met through NAMI, which is the National Alliance on Mental Illness in Dane County. Is the affiliate. And so I would ask that questions are reserved until the end of the presentation, and then I will go ahead and share my screen and get us kicked off. Oh, I'll need if I can request the ability to share my screen, please. There we go. All right, can everyone see the presentation? All right, I see a thumbs up. All right, so I want to explain a little bit about my role and kind of the connection between NAMI, where I was previously employed, into the City of Sun Prairie. So for the City of Sun Prairie, I lead our public relations efforts and our diversity, equity, inclusion efforts. And part of that does encompass our values around mental health and serving those with mental health issues. Prior to joining the City of Sun Prairie, I was actually working with law enforcement around the local area, but specifically with Sun Prairie. So I was organizing and coordinating crisis intervention trainings, which we'll talk a little bit more about later, for Sun Prairie law enforcement. So that's kind of my connection there. And so I want to start and talk about just mental health, yes, in Sun Prairie, but on a national scale. And then Jo will later on share her lived experience, which I always think is really impactful when talking about mental health issues. So I'm going to time myself to make sure I give Jo enough time, but what I want to cover with everyone today are kind of the basics of mental illness. And so when I talk about the basics, what I'm talking about is the terminology and phrasing. I think a lot of times that stresses people out of, oh, I'm going to say the wrong thing. But I want to talk about, like, when you're talking about mental health issues and having those conversations or presenting publicly, what's helpful terminology and phrasing, and then talking about what it is and what it's not. What are myths and facts around it? And this especially comes up when we're talking about gun control and a hot topic like that. And what are some of the causes behind mental illness? And then I want to transition and talk more specifically about mental health issues, both in Sun Prairie and Dane County and on that national scale, and then transition into Jo sharing her story. So when we talk about terminology, I'm talking in a first person language. So when we refer to someone living with a mental health issue or a mental illness, it's a little outdated and now considered offensive and unhelpful when we refer to someone as, let's say, so-and-so is a schizophrenic or they're a depressive. And so even kind of the phrasing of like mental health issue, mental illness, some of that can depend. I use them interchangeably, and I've seen them in reports and documents used. So if we're talking about mental illness, you can also say mental health issue or use the term mental illness. But when we're referring to people and engaging with people, helpful examples look like so-and-so or this individual lives with depression or this person experiences schizophrenia. I have heard, especially at my time in NAMI, when talking and engaging with different generations, where a person may be referred to as, oh, they're a schizophrenic, or being defined by their mental illness, which is actually, again, unhelpful. And so that gets to the next part. If you look where it says, avoid labeling the person by their diagnosis. Now, I will say as a side note, there have been some people that I have met and talked to where they own and they're I don't know if proud's the right word, but it's part of their identity. They recognize their mental illness. So they will refer to themselves as, oh, I am a schizophrenic. But I say, as a kind of general rule of thumb, it's best to avoid labeling someone as such by their diagnosis. And in addition to that, derogatory terms when you're in this space and in this context, avoiding language such as junkie or crazy or psychopath. And again, that context is mental health, the way we know it and talk about it now, was not historically how it has always been treated. It has historically been treated as, oh, a person is, referring to them as crazy, or it's this thing to be looked down upon. And obviously our attitudes and beliefs have changed based on the data and how we view and value people. So I just think that's a helpful tidbit kind of when we're talking about the basics of mental illness. When we talk about what it is, I've found in discussions with people that there's kind of this idea of someone who is living with a mental illness, and it maybe is that person on the street who looks disheveled. There's kind of this like stigma and visual attached to it, and it's not always that. For some, that may manifest how their symptoms are with their mental health issue, but in a general sense, a mental health issue or mental illness, it's a condition that affects an individual's mood or behavior or feelings. And to the degree at which that does that can vary and is very individualized per person. In addition to that, there are some where it may affect their ability to hold a job or may affect their ability to engage in certain circumstances with certain people, but it's very unhelpful and counterproductive when we apply like, oh, someone living with mental illness, they can never live like a quality life or they can never hold a job, which is just not true. And kind of reiterating that point, it's different for every person. So someone who experiences depression or might have a bipolar disorder, their symptoms can manifest in very different ways. And so I think it's helpful not to generalize what the symptoms or the assumptions of what the symptoms can look like. What it is not is the person's inability to be in touch with reality. So for some, let's say if they're experiencing schizophrenia or hearing voices, there may be a difficulty in understanding what is real and what's not, but that's not the case for everyone. So again, I think going back to that kind of example that people think about a lot of, oh, someone living with a mental illness, or even the phrasing of mental illness and associating it with the person walking down the street talking to themselves or taking their clothes off and resisting law enforcement, it's not really always the case. When we talk about destigmatizing it, I think there's a sentiment there of, oh, a person with a mental illness is someone to be pitied. There's someone that might be seen as having a weakness or a defect. When we talk about mental health issues in the workplace, especially my time at NAMI, this came up a lot of like, oh, I don't want to disclose that I need to use sick time or whatever PTO time is allotted to me because I'm struggling with my mental health. And I don't want my employer to skip over me for that promotion I want, or I'm scared to be seen as being weak or defective. And the truth is, every person at some point in their life either will experience a mental health issue in the form of maybe anxiety or depression or whatever that might be, or like maybe some of you are living with a mental health issue. And so it's not a sign of weakness or defectiveness, and it certainly doesn't prevent you from living a quality life. And lastly, treatment for mental health issues, it's not a one size fits all. I've interacted with individuals where taking medication is super helpful and gets them on the right track, versus there are others where they're going through a series of trying different medications paired with talk therapy or support groups. And so there's no one formula to apply to everyone when dealing with something like mental health issues. On the flip side of that, I think it's helpful to address myths and facts, especially on the realm of some of the things we've seen when it comes to gun violence and violence in general, when it's paired with the topic of mental illness. So one of them that we always see, and when we were going into schools talking about this, if you talk to someone about suicide, it'll make them more likely to attempt, which is a myth. So when we were talking and doing presentations at my time at NAMI with students, there's a lot of questions about, well, I have a friend who has disclosed to me that they're having suicidal ideation. What should I do? Because I'm afraid if I bring it up, they might be more likely to act out on it. And so which is just a myth. So actually, we have found that helping or talking to people can actually be part of the solution and a preventative measure of being and allowing someone to know that you care enough to bring up the topic and that you're willing to be there for them. So it's just a myth that if you bring up suicide to someone, that they're more likely to attempt it. If you have a mental illness, it will just go away on its own. I think there are times with all of us as people when we know we're struggling with something and there's a tendency to avoid or not deal with it or hope it goes away on its own, which I think for this is just not true. But luckily there's support. And if you're in the Dane County area, there's a lot of resources to help when dealing with mental health challenges. People living with a mental illness are violent. And so I think some of this, you have to look in the media of what has been portrayed. So folks living with a mental health issue, if you see in some movies, it's often portrayed in a very extreme way where they're immediately going to harm to themselves or to others, which is not always true. In fact, actually, folks who experience mental health issues are often more likely to harm themselves if it gets to that degree of suffering from their mental health issue. And then the last one I think is really important too is mental health or mental illness diagnosis lower one's quality of life. And that's a really big reason every time we talk about this topic, I always want to bring someone to share their story, whether it's they've lived with themselves with a mental health issue or they have a family member or friend that lives with it, because there is this idea that, oh, if you live with depression or you have a bipolar disorder, or even if you're experiencing schizophrenia, you can't hold a job, you can't have a family, you can't do all these things. And so it's a very kind of limiting framework that we place on other people. And I find when folks feel stigmatized or feel like they're going to be judged, that in itself limits them. And so it's kind of this self-fulfilling prophecy in a way. So it's really important to destigmatize that, and especially having folks share their story, that's just not the case. When we talk about facts, again, asking someone if they're contemplating suicide, it really is a preventative thing. And I understand that that conversation is not an easy one. I don't think that is a common topic that we're all trained on how to have that. But I do think expressing concern and care and say, hey, I'm concerned about yours. Is there anything that I can help with? But in the context of the workplace, hey, there are some resources that might be helpful to you down in the break room or in HR and regards in the context of mental health. I kind of touched on this if you skip down a couple, but people living with a mental illness are no more likely to be violent than any other person. So again, I think media plays a big role in this. So we see, folks who in certain movies or shows are struggling, emotionally and mentally, and they have a weapon. And so that's kind of characterized of, oh, that's what all people struggling with mental health issues and illness go to, and how that expresses itself. The one I just want to highlight at the bottom is with proper treatment and support, folks can live, even if they have, whether it's situational or chronic mental health issues, can lead high quality lives. When we were doing presentations with the kids and stuff, we would highlight and bring out stories of celebrities who have been open about struggling with depression or bipolar disorder to show that there are folks who have achieved incredible things throughout their life that have been open about struggling. And so again, it really is just an effort to destigmatize and show that whether you're struggling or not, you can still achieve these things. And there's support, whether it's medication or support groups or therapy, to kind of get you on that trajectory. This was a big one of what causes mental illness. And back at my time at NAMI, this was specifically really difficult because we would have families call us and their loved one was in such a state where they wanted to have them committed because of their mental health issues and the ways that it was expressing itself. And they would also want to know, like, what causes this? Because I think there was a lot of shame and guilt and confusion of, I have nurtured my loved one, or I believe I've nurtured my loved one in such a way, it doesn't make sense that they would be suffering in the way that they are, or their symptoms would be expressed like this. And so we always tell people, it's hard. There's not really one specific cause that you can narrow this down to, but rather a variety of causes. So you can look on the screen and see some of it is environmental, situational stressors. So if maybe you're living in an environment where, let's say, divorce or a child custody battle or alcoholism, a variety of different things are prevalent, it is hard to maintain a healthy mental health status through some of that. And that's why even at the bottom I wrote, there's a difference of like chronic or situational. There are some folks who have and live with a chronic mental health issue where they've entered into a state of recovery, they've accepted it, and for the rest of their lives, they're going to have to embrace the treatment that's set out before them to live with their mental health issue. First, there are others where, based on circumstances, again, maybe it's struggling with alcohol, or maybe it's a divorce, or just a very significant life event, it's a situational stressor, where as soon as that, with the right support, that kind of stressor is removed or worked through, the symptoms of a mental health issue are not as prevalent. But some of these can be biochemical imbalances, genetic factors, things that run in the family. That's been a common one, or it's a combination of all, or it's the environment, it's imbalances in the body, and just those genetic factors if it's been common throughout your family. So it's hard to just pinpoint. I think that's a human tendency. We want to know the why of something, but it doesn't always present itself that way. When we talk about mental health on that national level, some data I find helpful when pulling from the National Institute on Mental Health to show kind of the seriousness of it and kind of the significance is that 1 in 5 adults in the US experience mental illness each year. And that's a pretty significant part of the population. And I think in addition to that, how do you provide support and services? Because that 1 in 5, not everyone has access to insurance, or if they do, the help and support that they need may not be covered. And so I think that's a pretty significant statistic. And in addition to that, so talking about serious mental health issues where they substantially interfere with or limits one or more major life activities such as a career or raising a family, that's also a pretty high number at about 4.8% of adults. Kind of to my earlier point right here of only 43.3% of adults with mental illness received treatment in the past year. And one of the things I find really interesting is that these are numbers reported of folks who have had that diagnosis of living with mental illness, and doesn't fully capture those who have not been diagnosed yet for whatever reason of barriers to care, or just not being able or willing to go to the doctor and receive that formal diagnosis. And then lastly, suicide being the 10th leading cause of death in the US, with over 48,000 Americans dying by suicide annually. So pretty high numbers there and pretty significant statistics showcasing where does our country stand when it comes to mental health. When we talk about Dane County, and I'm pulling this from the 2019 Dane County Behavioral Needs Assessment. And so if you've never had a chance to check out that document, obviously a lot of significant things have happened since that when you think about the pandemic, but also issues that we've seen in our country around race and ethnicity, like the killing of George Floyd. Obviously this needs to be updated, and it would be interesting to see with the pandemic how certain things have changed, but that information hasn't been posted yet. But I do want to just side note at the bottom left corner, when we say serious mental illness, the definition of that, of a mental, behavioral, or emotional disorder that results in impairment, like there is an effect in your day-to-day. But if you look at condition prevalence, so the department, or the Wisconsin Department of Health Services, estimates 77,563 adults in Dane County have experienced a mental health issue. So at the time of this, that would have been 18.2% of the adult population. So again, when reading statistics, I always try to note too of like, when you're capturing that of folks who have had a mental health issue, it's important to consider all the folks that are going undiagnosed, again, either through stigma or because of barriers to access and or both. Nearly 10% of persons over 12 years of age have experienced substance use disorder. And so that's another thing when talking about mental health issues, is kind of the issue of dealing with addictions or substance abuse and misuse paired with that. And then 41% of those individuals experiencing a condition of a mental, or experience a condition of a mental health condition. So it's becoming more and more like prevalent of this issue, and how do you treat that? And I think luckily we have generations coming up that are more willing and open to talk about mental health issues, so we can better diagnose and better see what are the treatment options. But I think health insurance coverage is a big part of this too, because even if you are able to receive that diagnosis, are you going to be able to receive the care that is required to treat that? So what the report also shares on is, in terms of health insurance coverage, most folks in Dane County are covered by their employer, which isn't really surprising. And so you can look below that as Medicaid, Medicare, uninsured, and TRICARE. And so the difficult thing about like Badger Care is that it's a very small amount of providers that will accept that, and very long wait list. So even though Dane County is very resource rich compared to other counties, there are still long wait lists to access services. And so it's really helpful for organizations like NAMI or the Behavioral Health Resource Center throughout Dane County, who can offer connection to resources, but also offer, as best they can, free support in the form of support groups or classes. So I think it's just a helpful snapshot to show where we at as a county based on the data. One of the things I hear when talking or in different contexts where there are community leaders, such as a lot of folks attending this meeting, is like, what are some of the tangible things that can be done when we think about our organization and the community of how do we better serve our community members who are struggling with mental health issues and our employees? So a couple of things I just wanted to highlight that maybe your organization can consider and community. The first one is the NAMI Stigma-Free Pledge. So what this is, and we took this a couple years ago, is we pledged as an organization, we want to be able to let our employees know, like, we're interested in their mental health. Well, how do you do that? Well, we pledged our commitment, and there are certain things that we've done, such as looking at our policies. So for example, we looked at our HR policy to see, like, hey, if someone is really struggling with their mental health and it is impacting their work and they're just not able either for a limited amount of time to be able to show up at work and do that, what can we offer them? And so we did change some of our policy language to assure folks that if you're struggling with a mental health issue, like, you can take time off. And I want to add a nuance here. We didn't do mental health days. So I know maybe some of you have heard about that, where there are certain companies that give mental health days, but they actually very much go unused because in order to take a mental health day, you would have to disclose to your, like, when you submit your time off, that it's a mental health day, and that actually prevents people from wanting to do it because not everyone wants to disclose that they're struggling with their mental health. So we changed our language to let people know that, hey, include in your PTO if you need to take it for mental health reasons, not necessarily that you have to disclose that, but that's there for that reason too. In addition to taking the stigma-free pledge, we also wanted folks to be able to, like, come and actually learn about mental health and what does that mean for us as an employer in the workplace. So we did partner with NAMI Dane County to lead a variety of workshops for our executive leadership team and staff, where you got the formal education, kind of like I'm giving now, but we paired it with a lived experience panel, which is, what Jo has been a part of sharing their story. And some of this was folks sharing their story of, hey, I have a loved one with a mental health issue. But then folks came and also shared, like, I'm an individual who struggles with their mental health issues. And they also give feedback of what makes kind of a safe employer. So if that's something your organization is considering, I highly, highly recommend working with NAMI, but primarily also for that lived experience panel so people can ask questions and hear directly from people impacted by mental health issues. We also turned this on the community. So in addition to doing staff, we offered a variety of community sessions with a similar format. We have formal education to lay the groundwork for mental health issues, but we also had lived folks on the lived experience panel where they could come. And it was, I will say, like, I went to all of them because I organized them, but they were really powerful. There were folks coming and freely asking questions once they felt comfortable. And so I think those are good things to open up to your community to show that you do care, but it offers a level of support and introduces them to a community resource that maybe they wouldn't have known about it. And additionally, too, we have a social worker in our police department. So we were able to use our ARPA funds to kind of get that jump started. And so now we have an embedded social worker that when there's mental health calls, they can go and connect with the individual. And after the incident is worked through, they can connect them to resources as well. So those are some of the tangible things. But in addition, a couple more include, we did have an autism forum. And so again, I know there's nuance between a mental health issue and autism, but that was a part of it where we gathered our officers in our police department and members of the community to talk about, hey, how does PD respond to not only mental health calls, but how do you work and support an individual if they're in a crisis or struggling and they have autism? What does that look like? And so there's been a lot of creating community spaces where we can come and folks can ask questions directly. And then lastly, I mentioned this as this is my introduction kind of to the City of Sun Prairie, or the connection, was the crisis intervention training. So CIT programs, and there's kind of two versions. There's a CIT, which is a week long, and CIP, which is a couple days and more broad. But CIT is really for first responders and how to better kind of give them that cultural competence when working and serving someone who is having a mental health crisis, who is really on the brink of actually maybe committing suicide. So it really trains them. And so if your law enforcement agency this is something that could benefit or you're considering it, I highly encourage it because it's a week long of programming and talking to doctors, talking to individuals with lived experience. And it's just been a really helpful thing for our police department to go through it when interacting with individuals. The other thing I want to share too, in Sun Prairie, we have the Sun Prairie Wellness Coalition. And so what this is it's a group of just individuals and community partners who come together and care about wellness in Sun Prairie. And so a big emphasis on that is mental health wellness. And so they've led a variety of different awareness initiatives. I think they just led their first kind of mental health resource fair where folks from all over Dane County came to talk about their resources for the community. And so I don't know if you have passionate community members in your own communities who are learning to get into something like this, but this is a really great example. And so they're newer. They started about, I think, a year and a half to 2 years ago. And so they're gaining traction and they're working on gathering data specific to Sun Prairie around mental health needs, more honed in than what the Dane County one showed. But this has just been a great group of folks who just care about wellness and do a variety of things, such as if you look at the bottom, there's been youth mental health first aid trainings, there's been community workshops, and there's even been social events too to get folks out into the community and just talk about mental health and the struggles around it. One thing I want to add too that I didn't add on the slides, if this came up at a conference that I thought was really helpful, is folks don't always necessarily think as like the programming the library or Parks and Rec offers as a component or a facet of mental health. Well, those things certainly are. And I use that as an example of, let's say, winter. Winter in Wisconsin has its challenges. It's dark, it's gray, the sun is not out. But your parks departments and your any department that's offering programming for the community, those things play into mental health too, because it gets people out and it offers them the opportunity to go and either learn something or engage with others. And so that's kind of a facet too of not everything around mental health services and programming necessarily has to look like crisis or training, but can also just be the recreational things being offered too. So I just think those are helpful examples to show kind of what's going on in Sun Prairie as we continue living out this value of serving folks with a mental health issue and the different ways that that can look. So I'm going to pass this over to Jo now that I've kind of laid the groundwork and the foundation for it. And I want to give Jo the opportunity to talk more about herself and share her story. So Jo, I'm going to hand it over to you.
Thank you very much, Jake. I appreciate being able to attend this gathering this afternoon. My name is Jo Oyama-Miller, and my story goes back a long ways and illustrates how important community policy makes a difference in my loved one and my family's lives. My relative is my brother-in-law, who began to display his paranoid schizophrenia in his late teens and early 20s. At the time of his first psychotic break, he was under the guidance and care of his psychiatrist, therapist, and he had a loving relationship with his college sweetheart. In fact, they were even engaged for a while. After graduation from the University of Wisconsin, he took a job out of town, and things began to spiral for him. His fiancée broke off the relationship as his paranoia intensified, and she began to feel unsafe with him. The distance between them was also a barrier, and within a short period of time, he began to feel very, very close, and psychologically, things were unbearable with his family and his support so far away. Things were better for a while, but then his employer called his father and asked if they could come and get him. They were beginning to see behavior that they felt was impairing his job performance and his workplace. So his father went out and brought him back to his home here. And shortly after, his fiancée broke off the engagement, and his loneliness just intensified, and with that paranoia, and before long, he committed a felony, killing a coworker at his job. Upon the family hearing about the killing, his father waited patiently at their home. And when the Madison police came to question him and other family members, I remember his father asking Police Chief David Cooper if he, that father, could be the first person that his son would see when he drove down that street. Chief Cooper said yes, because he believed that what the father had told him would be true. You see, his father had told his son since he was a little child that no matter what happens to you, you can always come home. He believed that his son, even in his paranoid state, would remember this lesson. And so Chief Cooper allowed the father to sit in the middle of the road. So when his son turned that corner, he would see his father first and immediately. They had a chance to hug, talk, and the son was reassured that things would get better now that he came home. Understanding how a mentally challenged person feels, thinks, and can act is a difficult thing to predict. But both Chief Cooper and his father believed that these personal relationships and trust were paramount to lessen the dangers to himself and to others. My relative was calm when he saw his father. He told him what he had done and why. The police chief was able to talk to the person, take him into custody without any trouble. In the ensuing trial and months of incarceration at Mendota Mental Institute, our family and I in particular decided to learn as much about mental illness and the impact that it has on police, family, individuals, and our community. My loved one was adjudicated to be of unsound mind and unable to discern his crime at the time he committed it, and he was sentenced to Mendota Mental Health until he was deemed to be safe and able to return to society. His time at Mendota was over 17 years. But during this time, it was important for our family to know that treatment continued and that we were allowed to spend holidays, birthdays, and do ordinary things with him. I was able to bring my children, who were 5 and 3 at the time, to visit and spend time in the community room. Now, these family visits at the state mental institutions are severely limited, and families are separated in so many ways. I can assure you, I would not be able to bring my children to interact with their uncle as we did back in the 80s. Upon his release from Mendota, the family worked closely with his therapist, his rehab vocational counselor, and case manager to help him integrate it back into society. His parole and his reentry into the community took many years. He was on parole for another 17 years. But in the end, my loved one found meaningful work. He worked at the state in the Department of Revenue for over 25 years before I was able to find out, did he get any retirement? And with that retirement, what were his benefits? We discovered that his long-term work and continuous work allowed him to be under the state health plan, which was one of the biggest concerns that we as a family had, even though he was covered under Medicare, the fact that it would be limited. And the health plan from the state was much better. So over that period of time after and during his work, the family helped him buy a home. He learned to live with roommates. He managed his own finances, and now he still does. I tell him that at the age of 65, he does not have to worry that he's going to die from his mental illness, his suicide ideations, or his paranoia. But he will be like the rest of us. Old age, maybe dementia, maybe his health will fail, which we know it will because of the many years on a psychotropic medication. I work with him to look at what are his options for long-term care within Dane County and with his medical needs. Does his mental health challenges still exist? Yes, they do. But together with his family and the community resources that allow him to live, work, and reside in his community, he does, and he can. And one of the things that I do is to make sure it's according to law in the least restrictive basis. Education, training, empathy, compassion, and programs make the changes needed to allay the fears, provide the hope, and teach resilience to everyone concerned about mental health. Training city leaders, the police community to understand the mental health challenges individual space is paramount to changing discrimination, stigma, and community norms. Mental illness is just that, an illness of the brain. And we need to teach everybody involved in the community that when the brain is altered because of trauma, an accident, physical abuse, substance abuse, there are a myriad of ways to ease the situations and improve the neurological impact on the brain. This type of forum today and connections will help us to allay and help underline the connections needed for you, your city, and the county. Ways to refer families and individuals to programs is necessary that all city leaders know. And Jake really illustrated that with all the connections Sun Prairie has done and what I continue to do in my own community. The best thing that we can teach those with mental health challenges, the community and the families, and you, is that there is hope, there is resilience, and recovery is always possible. The work that Mayor Esser and Jake is an example of what I hope that you will try to emulate in your community. Another way is to look at having peer specialists come in and inform you how they can help. Those are individuals with lived experience. They're one of our newest employment factors that you can have on a limited basis, full time, but they can really enrich your departments and your understanding of what mental health challenges are. Remember, in our group today, meeting this afternoon, 1 in 5 of us will experience a mental health decision. Not to even think about 1 in 5 of our families, our extended family, will also experience mental health challenges. Mental health does not discriminate. It will attack and strike anyone and everybody. It does not pit its victims in many ways because of age, ethnicity. It will choose whoever has those factors that may be displayed throughout life or for a particular time in life because of those stressors. We are all vulnerable to mental health challenges. And if you want to protect yourself and your family, I know you will develop a plan and a system for yourself. But I'm asking you to look at the family as your community as your family. And when we do this, the changes are possible. And so both Jake and I will be glad to entertain any questions and to help you to appreciate your workforce, because there are people in your workforce who have these challenges. You may know them, as well as you may not know them. So we're open to any questions at this time.
Okay, thank you, Jake, and thank you, Jo. That was pretty powerful, a very powerful message. And I just reflect back onto conversations, discussions that were had when I was growing up, and how those conversations have now changed in the times that we're in. It appears to me that at least we're making progress in recognizing the issue, and the fact that we're talking about it publicly, I think, is extremely important. So let's open it up for questions. If you can unmute yourself and introduce yourself and ask your questions, please.
Well, one thing I will tell you, in Dane County, the most vulnerable of your population right now are the low income, the disadvantaged children 8 to 11. They have the most undiagnosed issues. They're suffering trauma, not just because of COVID and isolation, but the changes in the community and education. And we lack resources to address these issues. But the sooner you begin to look at school systems, community supports, how your library, your police, your family, your housing, if you don't address these, they will keep on growing and grow and grow and grow.
Are there any municipalities that have been dealing with this as Sun Prairie has? And are you trying to take steps to improve the situation? Maybe that can generate a conversation.
I continue to work with my older persons in Monona and to make sure, and they have addressed a lot of it by doing a lot more young and youth programs to making sure that it's open, it's as free as possible, the cost, and find out what are the barriers for children not to be able to. They're working closely with our school systems to say, are the educators aware of this, and are they talking about it? Social workers, just the idea of talking about with the children and families of the cutters that are at that very young age. And I see that in the families that I work with in the family to family program. A tremendous number since COVID that are under 11 that are cutters and impacting harm to themselves.
Okay. I do have a question for, I'll get to Lisa in just a second, a question for Jake and for Aaron. As you were going through this process in Sun Prairie, what was the feedback that you received from your employees?
I can start us off. I think it takes time. I don't think you start off getting people to be vulnerable because it's this kind of built in of like, oh, I don't know how it's going to land if I'm open, that I struggle. So I guess what I would say is, ideally, I know the kind of there's a utopian type desire of like everyone comes to work and you know they feel comfortable enough to share other things, but that's just not the reality. But what we did do is when we were offering the sessions, it overall got good feedback because I think staff were interested, but I would just say it takes time. And so I think what I was really intentional about is letting folks know where the resources are and what they are. But I just think it takes time to build that into your culture where people feel comfortable disclosing that. And the last thing I'll finish off on is like, I have a pretty strong relationship with my direct supervisor to where I can say, hey, like, I am really struggling today based on this circumstance and it's impacting me emotionally or mentally. Like, I'm going to need to take a day off because there's a relational comfort there. And I think that has to be kind of embedded between supervisors and employees. But Aaron, if you had anything else to add.
Yeah, I think the biggest thing for us is that we're trying different things. We don't know exactly how, what's going to make a difference or not, or what's going to be that key thing. We happen to see other communities were hiring social workers in the police department, and we thought, well, that may make a difference. And so we tried it and we found that it's beneficial. And so we're continuing it. Same thing with our employee clinic. We have an employee clinic that we share with the school district. We added a mental health professional to the kind of system of care there for our employees to go to and have a conversation with that person. And so you don't know how many employees will take advantage of that, right? And so you try a lot of different things to see what kind of is working and what kind of connects. And so I think the biggest thing for us was trying a number of different things to see what really makes an impact in our community. So
okay. Lisa, you had a question or a comment?
Yes, I was going to ask Aaron and Jake to talk about the impetus for this work in Sun Prairie, and what kind of support did you get from your council, and what kind of investment did you need to make financially? And then for Jake and Jo, I was going to ask if there are cultural barriers to addressing mental illness, including language, and if you could talk about those too.
So the first one, I think, was kind of your like about resources and getting that started and the impetus of it. So some of this came out of, again, prior to even being part of the City of Sun Prairie, I was involved with the City of Sun Prairie just on the outside as working with their law enforcement. So I think there was already kind of a pre-existing interest and care and concern for it. And so I think when I came, I was able to kind of assess in my role and what I was responsible for and the resources I had of like, oh, we could take this further. So, we could take this further into the community because it was concerned. We could take this further with our own staff. And so that was kind of the impetus of like, recognizing the need and also knowing like, hey, there's some things we could do to better embed this in our organization in the community. As far as resources, some of the things Aaron brought up, such as the social worker, we used some of the ARPA funds that came when that was available to jumpstart that. But as far as some of the programming I've had, it hasn't been a like significant cost. I mean, we work with NAMI because I work with NAMI Dane County to coordinate the programming, and they will have like a fee. But yeah, it's not been a significant cost to get some of this running. And then even our own Sun Prairie Wellness Coalition, which is not like city driven but community driven, we've given them resources when we can or when they've been able to apply to get some of their initiatives up and going too. So I don't know if that's too ambiguous or too vague, but as far as I hope that answers your question.
Yeah, I think the significant resource part is the social worker. We did use ARPA to kind of work it into the budget, but it does have a levy impact. And so the city council has been supportive of that. In addition, the mental health professional that we have within the employee clinic, we do have a cost there that we share with the school district. And so those have been the significant investments, but the city council has been very supportive of those investments.
Lisa, going back when the situation happened with our loved one, our family was very much in the public eye. My mother-in-law was in state legislature. Since then, my husband has been in the state legislature. And we made a concerted effort that we would not hide any of who our family was and what we did. We knew that we had to say, it can happen to you. It can happen to your neighbor. It can happen to whatever. Is that we had to normalize that. And as a result of what my mother-in-law did 40 years ago, we have seen other legislators come in and admit to their children being drug addicts, okay? That's why there's legislation that has passed on the substance abuse and on involuntary commitments and all these things, because people are taking their responsibility and trying to get rid of the stigma and shame and discrimination. And that's really, really important. The other thing that I do very, very deeply is working with immigrant populations and to say, how do we help you? What is different from the way that we have to express and get programs allowed? So within the Hmong population, having to work with the clans, what will they allow? Because if they allow it, people will follow suit, right? Within the African American community, this is not something that's not talked about, all right? In the Latino community, yes, we want this to happen, but we don't want to publicize that we have this within our community. And so we've had to do those small behind the scene things, and we include them. And then now all of these sub organizations are willing and wanting to do their own training and way of approaching their families, because it needs to be done differently. The words that you use, like Jake talked about, within the Latino community is very different than what we would use in the white community or even within the Asian community. And we have to be respectful of that. And we try to find those leaders within those communities with lived experience, because that's where that trust comes from. And that's really the cornerstone of programs. That if the police doesn't have the trust of the community, it doesn't matter that they have a social worker. You know, if you don't have a housing person that's going to look or be open to the homeless and to say, we will give you whatever we can find, we will help you find what you can afford and to be able to do, and work with landlords to dispel that if they put a homeless person in, right, and if they can meet the budget, they're going to live there because they don't want to be on the street. For the majority of homeless people, they do not want to live on the street. It's dangerous.
Okay, Todd, you had your hand up. Go ahead.
Yeah, Bobby asked the question, who else is doing some work here? And kudos to Sun Prairie. Perfect example of good government. We've done some things as simple as recognizing Mental Health Awareness Month and programming around it. But also, I coordinated an all-staff training last year where we spent a couple hours on a program just destigmatizing mental health amongst our workforce. And what I want to share with my fellow municipal leaders is how powerful it is to simply talk about it. I'll give you two examples. When we did that employee training, I got up to introduce the speaker, and I very simply sort of exposed myself to share a medication I take for anti-anxiety called Lexapro. I shook the bottle in front of it, and look, see, I do this, and my best time every month is the hour I get with my therapist, John. And you know, for someone in a position like ours in leadership in front of your employees to do that and say that is surprisingly powerful. And the two examples are, I had one employee just a couple months ago tell me that, hey, Todd, remember that session? I used to take Lexapro and I knew I needed it again, and I'm back on it now, and it's really helped. That's like just a little thing. And then the other was an employee who said that they've started therapy, and they remembered me sharing that. Mm-hmm. It was like a 3-minute conversation that I had in front of my entire staff, but all of a sudden, two little touch points just to talk about it is spectacularly impactful.
It's amazing. Sometimes it's the simplest thing, as Todd just suggested, that can make a huge difference in someone else's life. Other questions or comments? I guess I have one last question if no one else does. How does this dovetail into the CARES program that the city of Madison started a year or two ago? Does anybody want to talk about that?
I guess from Sun Prairie, I'll try my best, Bob, as we were lucky enough to receive some of the funding from the county for that program. And so we're going to, I guess, be sorting that out. How does that integrate into what we're doing from a police response, and how much, how does the CARES program affect our response? And so, obviously we haven't started that process yet, but we're on our way. And so maybe that's something we can report back on, Bob, as far as what our experience is. But we're looking forward to seeing how that all works.
Okay, thank you, Aaron. Mm-hmm. Well, we're pushing up on the top of the hour. One last opportunity for questions or comments. If not,
only to urge DCCVA to not give up on this topic. And there's many other members who are not here that need to hear it. So and I don't know if this is being recorded or what. But, okay.
Yeah. I think this has been one of the more powerful roundtable discussions that we've had for obvious reasons. And I do think that, as Todd suggested, we should do a follow-up program of some kind. And it would be nice to have more of our membership involved in these conversations. So Jake and Jo, on behalf of DCCVA, we would like to thank you for your time today. Very powerful message. Words cannot describe. So again, thank you, everyone, and have a great day.
Thank
For
you.
having us.
Thank you.
Thank you. Thank you very much. Bye-bye.
Bye.